jump on to COVID response. So as of Friday, we stood the big group down, and basically all the planning elements were pretty much complete. So it's basically just me, Lydia, Audrey, and Dr. Stein kind of working that right now. As of this morning, we're sending folks out to, let me back up. I sent DOH a note on Saturday saying, well, we really need the demographics of who's coming up positive and deaths so we can target our response to the most vulnerable populations. And they finally published it yesterday afternoon. So I got that out to everybody. So as of this morning, I've got one person going out to the nursing homes. And then I've got another one going out to senior centers. At the nursing homes, what we're looking for is just to see if what we pushed out over the weekend actually made it down to front counter folks, because sometimes there's a lag in those things. So what we're hearing is that at least one of them is screening people's temperature and cough when they come in the door. They have them sign in, they get screened before they go on in. So, and that's great. And I think I talked to the courts on Friday, and that's something we're going to talk to them about today, about, maybe we get a no-touch thermometer for the security guys, and as people come through security, they get checked for fever and cough, and if they are, you set them aside and then get a hold of whatever department they were going to be going to. If they're a jury pool, maybe something they would just excuse them for, at that point. So, and then
make sure that staff has the wipes and stuff available to them.
Right.
Or they say,
have you had any conversations with the courts about their willingness or ability to limit jury trials right now? Or
yeah, so we did. We talked. Actually, I went over there Friday and met with two of the judges, and we kind of did a walkthrough of what the processes are and where we might want to make changes. And the state Supreme Court came out with a position paper, I think late Friday, that said locals do what you feel you need to do, if you need to close or not. And the feeling over there is we can continue to go, but we want to watch, because there's such tight proximity especially in the jury rooms, and when they're going through their jury selection, you got people sitting shoulder to shoulder. So they're going to add health questions to the questions they ask folks as they're going through the jury selection, and then it all makes sense. So I did send out just a few minutes ago the latest cleaning recommendations from CDC to Frank and to Kelly. So those will be going out to our cleaning people and then out to county staff as well. This weekend has been just a lot of pushing information out. So today is, my staff and I are going to go out and contact people, make sure that message has gotten where it needs to go. So I did talk to Scott Hilber a couple times over the weekend to make sure that Mason General is where they want to be. And he had questions about canceling public meetings downstairs. Providence this morning decided that they're going to cancel public meetings. So I'll get a hold of Scott and see if Mason General is going to follow suit on that. So,
how about our access to tests and kind of what's the appropriate test protocol?
those are all out to the docs, and it's, if a person calls wanting a test, they need to contact their normal healthcare provider, because that person will decide, you know, is it going to go to a public health lab test, which we have pretty quick turnarounds, but we have a very small capability. Mm-hmm. Or will it go out to a commercial lab, which has a greater capability, but it takes longer to get the results back. So that's something that providers are working with right now. They've got the kits, because it's a standard panel, nasopharyngeal
So it
swab.
turned out to be the standard panel.
Right. So they can use the standard multiviral panels. That there's one for A, one for B, and one that covers, I think, 14 different viruses. So what they would do is use one of those and just send it in requesting a COVID-19 screen.
Good.
So I think we're pretty good there. I am going to check with them, make sure they have enough N95 masks for the people who are doing the screening test, because they're the ones that are most likely to get coughed on.
Mm-hmm. Yeah.
So let's make sure that they have those personal protective items. Everything I've been reading over the weekend is it's not a mist, it's droplets. Droplets are the big concern, horizontal surfaces, handshaking, that kind of thing. So I did send some stuff out to the churches this weekend as well, and most of them have outlawed handshaking. So they're going to fist bumps and elbow bumps and, you know, different things. And,
I appreciate everything you've been setting out.
Very helpful.
well, I think I put in about 12 hours this weekend just in pushing out, collecting and pushing stuff out. Because it's changing every few hours. DOH has moved the update from 11 o'clock in the morning to 2 o'clock. So that's going to change our whole battle rhythm on how we put
Yeah.
our work together and get news out. So what we were using was their 11 o'clock to do our 1 o'clock, and people would work on projects until 3. We'd roll them up at 4 and publish. Now I'm going to figure out how to do that cycle differently. So it may be publishing first thing the next morning, which is not as helpful.
Yeah.
So it means our information at that point is 18 hours old instead of being a couple hours old. If we can condense it, we will. I'll try to get it out in the evenings, but that's going to make it a lot tougher.
You also mentioned to me about having somebody on call.
So, yeah, right now I've got 2 nurses. Lydia is in Washington, D.C. And we're going to look at our 599 extension to see how many times we had hits over the weekend and look at possibly standing up a live interaction on that, maybe from 8 o'clock in the morning until 8 in the evening. I think it's important that we answer questions with a person rather than just referring to websites. But I want to see how many people are actually using it, and the 400 number, which is our front desk. Our front desk is not being overwhelmed.
I was gonna say, you fixed it though, right? Because right after we had all that information, I went to go and put it out, and then I started to do a phone call first. I don't know why, maybe because I just don't trust anymore. And guess what? It wasn't on there. There was nothing about it, actually. It was after hours, you could go to jail, you go to this, there was nothing.
So
And
the other piece of that is, I know the JIC is putting together a separate page. So we'll be able to refer people from the county main page to a COVID page, not necessarily just the public health page, and they have to search for it. Just have a page dedicated to COVID response with, you know, what does COVID-19 look like? What are the symptoms? How is it similar and different than the regular flu? And then cleaning. Just get out like 4 or 5 really basic things that answers most of the questions.
And the non-pharmaceutical.
Right. Right, so that's the other piece that I'm working today is calling everybody that we're doing meetings with the coming week, commerce, ecology, and are we going to continue to have those meetings? So.
Commerce is calling all their meetings out.
And ecology is not. So.
Can't catch a break on that Raya group yet.
No.
That's a tough one, guys. You guys don't understand. It's
Oh,
tough,
yeah.
I know.
It's supposed to be a 6-hour one.
Yeah.
Yeah, I know. I'm like, wow, that's all. Okay. Extra glass of Chardonnay after work that night. But yeah, it's just, right now it's a matter of getting information out. I've got a health officer response being written today in case we get a first case, and then a public information release in case we get a first case. So all I have to do is just drop in, because we can get that notification from Mason General or Thurston County or Kitsap, depending on where our resident winds up in the hospital.
Just so you know, I had words with an individual out in the front before this last meeting began. Very upset because even though they're telling everybody they should go to Dr. Stein for everything, they went to Dr. Stein's page and there was nothing. So could you please make sure there's a link to everything you're doing directly on his page? There's only one person in the hundreds who's going to go to his page.
Yeah.
You know, they go to the county.
Like on the website?
Yeah, but his specific page, demand, I don't know if that's the right word, just.
Okay, all right, well,
They were
I'll look at
upset.
I'll look at that.
Since they went out making comments about other people sharing information.
Oh.
And then went looked at for it, and found, uh-oh.
All
I
right.
thought that right on our front page.
No,
it
our
said
front
go
page.
to.
No, they wanted to.
You went to the health officer's page?
Yeah.
Okay, all right, got it. So, and are you getting all the information you think you need? Right, and where am I flooding you?
I am very appreciative. That keeps changing. I appreciate everything you're sending me. And as you know, I'm, sharing it out, and I know that everybody appreciates it because there's a lot of stuff they were being told that wasn't accurate.
King County has a really good
Right.
site, and so I.
And I did get a call from the sheriff's, not the sheriff's department, from the jail today, that they're finding people in the community that have been given bus passes from Seattle to anywhere as long as it's 2 hours from Seattle. So I want to try to run that down and find out if that's rumor or what is really going on.
Well, I hope it's just a rumor and not
Well,
fact.
let's
Yeah,
say, I
me
kept
too.
hearing that before,
But it came from the jail, and that's what they're hearing at the jail, so I'm gonna try to run it down through the homeless community and see if that's the case.
Yeah.
And then also the homeless community is like number one on my priority list as far as, you know, making sure we have good outreach there.
Well, that's why we have to be careful once it's there, they start traveling.
And so Kelly and I last week went and looked at building 10, and that would make a decent quarantine facility, but we have to bring in cots, and, you know, there would be a stand-up that would go with that. But we do have our alternative treatment site pallets that we could utilize.
And now that it's being determined it's not as much aerial, we don't have to have the negative pressure work,
Right.
which means we can take care of more people.
Right, it expands the
And some of
capability
the
that the hospitals have.
Yeah. Good job.
Okay, so it's just really busy. And I gave staff notice today that expect to have staggered starts or longer shifts.
To handle that timing thing from, on the release of the information.
That's part of it, and if we have to go to a case or more than one case, or we're doing, you know, other work, we're gonna have to have some staggered starts, I think. And if we have a hotline, we'll have to cover that as well. So I included the building department in that as,
Did we ever get any final testing or information on the Kirkland first responder?
I think they're coming off, there's been no symptoms, no positives, so I think they're
Good.
coming off.
Good. Let us know when that happens, that's a big thing to. for the-
I did answer a question from Scott
They're
Hilburn
off.
this weekend.
They're off.
Okay. About
The person
what would it take to put.
They're off, oh, that's big. They're
Yeah.
off.
They're off.
Mr. Press over there, they're off.
So, what would be the circumstance by which we would put the nursing homes under quarantine? And that simply comes back to, have they been exposed? Has a case walked in the door? Have they been exposed to a known case? But I think they're already very proactively screening people
I
at
was
the
gonna
front
say, is there
door.
anything we can do to help you to enforce or move forward with the idea of them testing for temperature and stuff as they enter that building?
It's-
Those buildings?
Yeah, that's a health officer call, and I've talked to Dr. Dan, and he thinks they're doing the right thing at this point. But we're gonna go around and check today.
Well, if we're needed for anything there, that's, you know, those people many of them can't leave.
Well, I want to talk to the hub today, and I want to talk to the senior center here in Sheldon too, about maybe it might be a
They're
good
all pretty
idea
vulnerable.
to postpone some things.
Oh, okay.
You know.
Because it's been the opposite, they moved to a cleaning, that's why they asked me to come, trying to get people there.
Yeah.
Because they're losing so much.
But
It wasn't my idea, I didn't want to.
Yeah, we still have a message, we're trying to get people to avoid large gatherings, so.
From the
if they're
DOH
vulnerable.
and
Yeah, and especially in the vulnerable populations.
And that's about the age.
Yeah. So I've got, Ben is going to touch base with the hub, and I think one of our people here in town is going to go out to the senior center today.
Good, good.
So actually, we're actually trying to, we pushed stuff out over the weekend, but I really want to make sure that it's getting down to front counter staff. Because that's our firewall.
You're doing a great job.
Well, thanks.